Hello again and welcome to this endocrinology series. In this session, I will be covering thyroid disorders. My name is Dr. Betty Dubé. Here's a captioning statement in case you do use the caption to let you know that the caption is up to 90% accurate. The learning objectives for this part is to again briefly explain the endocrinology system and negative feedback as it relates to thyroid gland, and we'll also briefly describe the epidemiology, etiology, and pathophysiology of the common thyroid disorders. Just to recap again, to remind you that the pituitary is the master gland and that's where it's located, and the thyroid gland that we're discussing in this part of the series is just situated around the neck area, and it does produce thyroxine. Again, I've included this for completion just to remind you of all the other hormones that are part of the main endocrine system. Okay, so just for the anatomy of the thyroid gland here, we do have it's situated just at the lower part of the neck. Normally has two lobes, and it's connected by this called an isthmus. Its job is to synthesize, store, and release two major metabolically active hormones, thyroxine, which is also known as T4, and triiodothyronine, which is also known as T3. These hormones influence virtually every organ system, affecting how fast our cells work. Even small disruptions here can cause big systemic consequences. So before we go further, it's important that we get comfortable with the terminology you'll see throughout the session. We use abbreviations such as TRH, TSH, FT3, FT4, TFTs all the time, so keep these in mind. I would recommend that you pause this video and have a look at this terminology. We also have terminology such as euthyroid, which refer to a normal functioning thyroid, hypothyroid, referring to when the gland is underactive or underproduces the thyroid hormone, and hyperthyroid, where there's overproduction of the thyroid gland. There's also the Graves' disease here and Graves' orbitopathy. Again, pause this video and have a quick look at this terminology. So to recap again, the thyroid doesn't just release hormones randomly, as you would know. It operates under the coordinated negative feedback mechanism, just like we learned in the previous series. So if there's a change in condition in the body from a set point, the change is detected, corrective mechanisms are activated, conditions return to set point, and corrective mechanisms are switched off. So it is a constant balancing act, and most thyroid disorders arise when this balance fails. So with regards to negative feedback in the thyroid hormone system, so thyroid hormones are essential for normal growth, development, and cellular metabolism. Circulating thyroid hormone levels are normally controlled through the process of negative feedback on the hypothalamus and pituitary gland. Okay. So low thyroxine levels, when there's low thyroxine levels in the bloodstream, it stimulates the hypothalamus to release the TRH, the triproptropin releasing hormone. This causes the pituitary to release thyroid stimulating hormone. So the thyroid releases more thyroxine. So normal thyroxine levels in the bloodstream occur. The TRH is inhibited from its release by the hypothalamus, and the production of the TSH by the pituitary is also inhibited. So normal blood levels are maintained. Okay. So when thyroxine levels return to normal, they suppress both TRH and TSH, preventing overproduction. So it is an elegant, automatic, and essential for keeping metabolism stable. Okay. So this diagram here shows the hypothalamic, pituitary, and thyroid axis, the central control system for thyroid hormones. So TSH from the anterior pituitary is the main regulator, and it's self-controlled by the TRH from the hypothalamus. Any disruption along this axis, whether in the thyroid, in the pituitary or hypothalamus can change the hormonal output and lead to disease. We'll see later how this helps us classify disorders into primary, secondary, and tertiary causes. Okay. So the thyroid physiology has the thyroid hormone has three core functions: synthesizing, storing, and releasing the hormones T3 and T4. These hormones influence growth, neurological development, and metabolic rate. Again, note the ratio. Far more T4 than T3 is produced. But T3 is the more active hormone at the tissue level. Understanding this helps explain why patients may require specific forms of replacement therapy. Okay. The ratio is normally of T4 to T3 is around 1 to 10 to 1. And the daily production is around 80 to 100 micrograms of T4, okay, which is equivalent to around 10 micrograms of T3. And those for you who've dispensed levothyroxine many times will probably now relate why the doses are the way they are, because we're trying to mimic this physiological stable amount. Okay. So with regards to classification of thyroid disease, we have it classified as hyperthyroidism and hypothyroidism. And under each, we do have categories of primary, secondary, and tertiary based on where the problem occurs, whether it's at the thyroid gland itself, or if it's at the pituitary or hypothalamus. Okay. There's also overt and subclinical symptoms, depending on the severity of the biochemical changes. Okay. I would strongly recommend that you watch this 16-minute video that explains the thyroid disorders are using very good diagrams, and also to help you wrap up this particular part of the lecture series. Again, it's the same video, 16 minutes long, and just to let you know that next we'll be delving into hyperthyroidism, and then we'll move on to hypothyroidism. Later, we'll examine each type in depth and look at how the diagnosis and treatment differ. Thank you for listening.